Welcome to Samba Samba. Enjoy the video.
You start by cutting off the main risks. Stop wearing lenses and use glasses. Wash your hands for 20 seconds before touching your face, and use a clean towel and pillowcase each day. Prepare sterile saline or boiled then cooled water to rinse the eye. This flushes irritants and helps clear discharge. Once done, gently wipe from inner to outer corner with a fresh cotton pad each time. Make sure to isolate items that touch your eyes to prevent spread. Next, use a warm compress for 10 to 15 minutes, 3 to 4 times daily to soften crusts and improve drainage. Warm increases circulation, which aids healing. After each compress, rinse the eye with sterile saline to remove loosened debris and apply preservative-free lubricating drops if dry or irritated. Clean eyelids gently with diluted baby shampoo or a commercial eyelid scrub to remove oil and bacteria buildup. Once this routine is consistent, symptoms usually improve. Continue hygiene to avoid reinfection. Finish by replacing eye cosmetics and disinfecting, or replacing the contact lens case before resuming lenses. This prevents quick recurrence. Keep practicing hand hygiene and avoid touching the eye. Expect gradual improvement over several days. Viral cases often clear in about 1 week, while bacterial infections can persist. If redness, increasing pain, photophobia, reduced vision, or fever develops, seek medical care.
Thanks for watching. Consider subscribing if we helped you.